Do you have a child that feels like it's scared of talking? Well, today I'm actually going to be diving into the world of selective mutism in teenagers. So stay tuned. Hi everyone, welcome back to my channel. I'm Anna Biavati, a highly specialised speech and language therapist, and I help families understanding my family dynamic approach and the Brave Muscle method around selective mutism, which is all about the brain. I am thrilled to announce my guest today, which is Dr. Elisa Shipon-Blum, as also known as Dr. E. Dr. E is the president and director of the Smart Center in Philadelphia and a world leading expert in selective mutism. I am so excited. Over the past 30 years, she's developed the evidence-based social communication anxiety treatment, or SCAT, and created CommuniCamp, and has helped thousands of children, teenagers, and adults overcome selective mutism. So, without further ado, here is my interview with Dr. E. Dr. E, welcome. It's such a pleasure to have you with me here in my channel.
Thank you so much, Anna. I'm excited. We had a talk recently and really, really loved talking with you. So we both love SM, and I'm excited to talk about teens, right?
Absolutely. So please go and check the other video where we talked about multilingualism and, the different approaches. So you'll find the link to the video below. But let's crack on. So understanding selective mutism in teenagers. So what does selective mutism look like in teens, and how is it different from when they were younger?
Yeah, no, I think this is a great question. And there's so many parents of teens that think, once you become a teen, it's hopeless and, I missed the boat. And that's not true, first of all. But also, so many people treat young children, and there aren't that many of us that actually work with teens and adults. So I've been working with teens for umpteen years, I guess you could say, many, many, many years. And I think the most important part, Anna, is what it looks like in teens, but more importantly, what is SM in general? And I think we just have to touch on it for some of the newer people because so many people focus on the behavior of not speaking without understanding that selective mutism is a social communication anxiety. It is so important to understand why a child, or a teen rather, is not speaking. Why are they not? Or why, if they're speaking, they're only speaking quietly, one or two words, not initiative, not elaborative, not expressive. It's very important. And as you know from my work, not speaking or mutism is a symptom. So for me, when I see a teen come in and we do a selective mutism eval, we want to comprehend, we want to conceptualize their presentation. So it's not just not speaking. So what I want the listeners to understand is if you focus on not speaking in teens and they've been selectively mute, you're going to keep going like a rat wheel over, around and round and round. So
Absolutely.
you got to get off and figure out why, and then figure out what stages are they in different settings. So for me, with teens, it's so much even more important. I don't like to say more because it's so important even in younger guys. But as you know, with teens, it's been around, right? So we
Yeah.
have to know the understanding of why they're not speaking, all of the comorbidities, the coexisting issues, and what are their baseline stages? What's the family dynamics like? What's their environment like? Who are they? Once we understand that, where mutism is a symptom, but they're not communicating or confident social verbal communicators, and we understand, all right, here's the reasons, what may have started it, what's maintaining it, here's their baseline stage in all these different social situations, then we can begin treatment. And I say it like that because too many people focus on the behavior of not speaking. But
I
interest,
absolutely love it because we have different categories. So we notice that there are some children that they seems to find that moving to, for example, high school in the UK. So they're like tweens, so 12, 13, and then it hits them, and people just go, what went on? But some teenagers, they have had that fear of communication for so long. And even more, exactly as you said, the focus is, oh, come on, just talk. I know we can, it's just even more. And I'm just thinking their brain is developing at a different stage. Now they're not developing language, is the social communication. Because talking is more than just saying hi, is what that means. And do you know, actually, Dr. E, I actually have a lot of teenagers watching my videos and commenting, oh my God, I feel the same. And I want to say, hey, you're not on your own. And that's exactly how lucky, actually, the people that come to your center and you do the camp, meeting other teens, and so they don't feel by themselves.
100% that social identity. In relation to what you said, as far as what makes a difference with the teens versus the younger guys, the comorbidities, the whys, are more exaggerated in teens. And why do I say that? I say that because the typical timid, shy child with basic treatment when they're young, through play, through exposure, will do well. And if parents are trained appropriately, the children do well, and the SM should not continue. So, why in teens is it continuing? Why do they still struggle?
Yeah.
I have found the whys are just so exaggerated, meaning those whys in younger guys were either missed or mismanaged, and as a result of that, it's only perpetuated. And that inability to communicate effectively due to their sensory, their processing issues, learning, cognitive load, executive function skills. Maybe they are bilingual and they're still struggling because they just moved to a different country or changed schools at a different time. The timidity, the social anxiety is really heightened. But those other issues, even neurodivergence, ADHD, autism spectrum, learning, processing difficulties, they're often more present in teens in comparison to the younger guys in terms of their whys. And they're so much more ingrained, and they've gone that many more years, Anna, without having give, take, back, forth of social communication. Comfort and connection and confidence fuels communication. And so, if the comfort building, the social connection, the confidence, the independence is not there, and that one of those pillars is missing, you're going to continue on with this challenge, especially as others continue to enable. So, parents still trying to protect, to rescue, or they're trying to, tell them to speak and tell them to do. And the teen
Yeah,
has
so
no.
that is the pressure.
Yeah, and they've become more avoidant now, and they're missing out. Look, let's face it. When you're a little guy, your parents are setting up get-togethers and play dates. When you enter middle school and upper school, you're not having mommy and daddy, set schedule play dates and get-togethers. So there's so much more on them now in terms of the expectation that they need to do to be able to be a social being, and they often don't know how, or if they do, they're so anxious and avoidant.
Yeah, so I'm wondering though,
That
what
was
is
a
your
lot, by the way.
it is huge.
I just
Please,
spilled it out.
yeah, please let us know. Is that how it feels? I think it's almost, I love analogies. It's like going shopping and you're going for three things, but you're coming out with 30. It's quite heavy,
That's
right?
me. That's me.
So
Yeah.
it's a lot to deal with.
Yeah.
So, what the outsider, what the family sees is yet again the words not coming out, or my teenager is choosing. I still hear that a
Uh,
lot. But here there is, how do they see themselves? They now have an image of a person, because they're not a child anymore, that cannot do it. And that is being, they've not developed that social communication, how to respond, how to laugh, how
Confidence.
to be. Yeah. It's way more. Communication is way more than using words. And can we just say acceptance? because they feel a bit weird. So
Yeah.
they're neither too little, so nice and cute, nor big. They're in the middle, and being in the middle sucks. I didn't like being a teenager. I don't know about you, right? But now,
Oh,
what is really curious in in my clinic, sometimes I do get, it's not, I have to say, it's not that often, but I do have parents that phone me or they contact me and they say, oh, do you know, I have a 13, 14 years old, the first time, and they are not speaking in school. And I am asking, how is that happen? So how are teens in, in your clinic, how would SM typically identified in teenagers, especially, for example, if they look very polite, they're very compliant, they do everything that they are told. So teachers would not necessarily think that they've got SM.
no, this is a really interesting question, and it's so multifactorial. First of all, it's more common, you can quote me on this, it's more common for teens to be able to speak. So they're not often completely mute.
Hmm.
They often can speak, but they're speaking quietly, one or two words. They're not initiative. They're not elaborative. Conversation starters are difficult. Expanders are difficult. The confidence is lacking. Maybe they're becoming more avoidant. You are seeing them start to not maybe do things as much as the kids are growing and going through, the social, and they're interested in, they're going through puberty and the typical stuff that middle schoolers and early and high schoolers go through. And everything about it, being social, going to parties, forming small group cliques in school. Like they often at that time start to feel more they're avoidant. And as a result, parents get frustrated. Why aren't you inviting these kids over? Why aren't you joining these groups? Why aren't you going to parties? And they often feel helpless, parents. And what ends up happening with some of these teens, which is why it's so critical to understand this and treat this, is you start to see mental health challenges even more. So it's not just anxiety and avoidance, you begin to see depression, lack of interest. So I
Hmm.
tend to see more depression, Anna, in the middle and upper schoolers. I don't tend to see it in the younger folks, partly because parents, teachers can set things up. Kids are very much more accepting when they're little. They're helping kids more. So, oh, she doesn't talk, I'll help her. But as they get to middle and upper school, Anna, there's not so much of that. The kids are starting to move on. They're starting to be like, look, if and it's not meant to be mean. It's just the nature of it. So how teens present is that sometimes it is families that have been in treatment for a while, but it's been unfortunately not the right approach. Or it's been missed and they were kind of talking, but not a lot because I see this as a social communication
Yeah.
anxiety. So you may speak. That's why I can't stand focusing just on mutism. Because look at these. Look, you think about functioning, Anna, socially, emotionally, academically, communicatively. Those four pillars. And what happens with teens is socially, they tend to really struggle. Emotionally, you see more struggles. And even if they're not struggling academically and they're the perfect student and they're the A student and they're gifted, they're struggling communicatively as well, right? And emotionally and socially. So although they're the top of their class, some of these kids were others, the whys of having some learning challenges, which we see many of, are really there. And that makes them feel worse.
Yeah. Again, we're going back into the perception. So, just to clarify, what we are seeing is teens that they are less engaged.
Yeah,
They can try and they can be functional sometimes. So there is not the total mutism that it takes,
right.
but is how do they see themselves? They are not really as part of a social group because the peer is very much going, you're either in or out. And they start perceiving themselves differently and then they shut down. And what you see is more towards the depression. It definitely ticks all my boxes. Let us know, is that how it is? Is that the experience that that you have?
I mean, yes, but I also think there's individuals where they want the help. And that goes back to
Yeah.
like kind of the parenting. Like, I don't mean the parenting, but more of how is this talked about in the home? Is it talked about with you need to, you should, why aren't you language, which tends to cause these teens to go
Yeah,
more.
totally anxiety provoking, right?
Shame and anxiety happens when, unfortunately, individuals or adults in their life are very much like, look, you need to do it and you need to and you should. And they feel small and they feel shamed and they feel more and they become more avoidant, more depressed, and more upset. And what you see in the teen years is lack of connection with their own parents. Not all. I need to say, not all. There's plenty of teens that come in with their notebook and they want help and help me do it. I really want to do it. And they're open about it and they're not yet depressed. And they're like, I'm stuck. I want help. And it's often the parents in those situations that along the way have been meeting them where they were at and they're still struggling. So together they're coming in. So it's not the parent pushing as much or you see what I mean? It's more
I
they've,
totally know what you mean. And I think that is, oh my God, it's just definitely those two categories. So there is frustrations from the parents' point of view, kind of like, right, is that what can we do? But my teen doesn't want to do anything. Or exactly as you said, they've kind of grown and grown and they feel that they've outgrown what they can do as the parents. And the teens kind of say, I think I'm ready. There are definitely two categories. I totally see it. Yeah, no, I love that. So then that takes me to understand. But then, okay, so wanting or not wanting, I'm keen to get better, or the parents would like to support them because otherwise they're not going to come out of it. What kind of therapeutic support do you typically offer to teens? And I know, everything is an individual, we get that. But what in your clinical experience has made such a difference for them?
there's many big differences, but one of the biggest differences is understanding. This is why in in my world, I used to do something called the Selective Mutism Comprehensive Diagnostic Questionnaire. It was a 24-page document that parents in-depthly filled out, and it was basically a whole conceptualization of their child. I would able to interpret it. We do something now called the Selective Mutism Evaluation, where it's basically all of those types of questions, their background, their history, medically, socially, communicatively, emotionally, their academics, their family environment, other challenges that they may have, like toileting, eating, sleeping, behaviors. We want to understand them. And so that's first part. We want to meet them, Anna, where they're at. I just talked to a family the other day. She has a 14-year-old daughter. She called the center. She said, my daughter stopped speaking a year ago. Doesn't speak to us, doesn't speak to our family, prior anybody, no friends, no nothing. So now you've got someone that's become pervasively mute, right? They were selectively mute. So you've got to figure out what happened, right? Like a change in schools happened, a new, the parents may have separated. A lot of stress may have caused that individual to go within themselves. So I do see more of these kind of pervasively like
Yeah.
avoidant, like disconnected kids too in the teen years. But what makes it different is when you meet them where they're at and you help them understand the bridge. Like they make their own bridges, non-communicative, non-verbal, transitional. We could certainly do a whole segment on the bridge, and then verbal. Verbal, quiet, one or two words, or more initiative, elaborative, expressive. And we teach them the bridge, and they realize even when they may not be speaking, because look, a lot of teens will speak in most places, just not a lot, and quiet and barely. And because teachers may not ask questions, they do appear very mute. And yes, there are teens that are stuck and they aren't speaking. They're stuck in the nonverbal and more speech phobic. But we teach the teens the bridge. So they see where they're at, Anna, and that you start to see them sit up and look at you more. And I am on the bridge. I can do that. And you begin with goals that are attainable, not go up to the store clerk, initiate without being prepared, without a script, without having an interest, just throw them in the deep end. No, you meet them where they're at. Where is their baseline where is their stage of baseline? And you accommodate those whys. We have so many teens that present with other things. Like, I can't tell you the number of kids on the autism spectrum. How many kids that have ADHD? How many kids have severe sensory processing issues? Some kids have speech and language, 30 to 40%. And of those 30 to 40%, many of them may have developmentally been okay, but now they're 15, 16, and they didn't have give, take, back, forth, a communication. And as you know, they developed a speech and language issue.
Yeah.
They meet the criteria. So we have to accommodate those other challenges in their treatment. So what makes this different isn't just shaping a like just basically exposure, but it's how do you set this up? And it's very cognitive. Cognitive behavioral therapy, understanding their feelings, having them help us set goals where we are like kind of giving them ways to do the goals where they have choices in their goals. So, in other words, we set it, we help them understand, all right, when you go out to a store, a restaurant, small groups in school, when you're going out and about, what can we do? What is our goals when we're going to visit relatives over the summer? So they're involved in the goal setting with the concrete written out goals, Anna. They know where they are on the bridge. They know their goals.
Mm,
Now, you may have a very avoidant teen that's like, I want nothing to do with it. They don't want to come to the center. They're very like, the parents will
yeah.
say, I'm sorry, she's not coming to the smart center. We're not doing it. So we will work a lot in the beginning with just parents, just helping parents change the way they speak to the kids, the way they understand them. And that for us, like when we do, one of the things that I'm so passionate about is parent education and support, which is why Communicamp is all day for 3 straight days. Because to be honest, if the parents don't change their ways and understand their child the way they need to, you're not going to get as much progress. So parent education, and you know this, Anna, because we've talked
Yeah.
about.
Family dynamic approach. It's so important because we do have different categories as that we are parents. When they are born, we're not given us, they don't, nobody gives us a book. This is exactly what you need to do
Yeah, they
tonight when
should,
you've
right?
got a child with anxiety. But you're absolutely right. So I just had a few thoughts in my head. It's incredible what you were saying. Meet them where they're at and also watch the way you communicate with your child. And we have different categories, but if we want to narrow it down, we might have those parents that they accommodate a lot because there's this super love, they're helicopter parents. Not a criticism, guys, it's just an observation. They just scoop them up, and that continues to keep whatever that they're not developing, in this case, communication. And the other one is the language of the shoulda, coulda, woulda monsters.
Yeah,
So that
yeah.
it's not done on purpose, but it's done in a way, guys, that they keep saying to themselves, I can't do it, or you can't do it, I should do it. So imagine hearing inside your head every single day that, what do you think your child's brain or your child's teenager's brain is going to believe that they can't or they should, but they've tried, but they're not going to try. So the brain is fixed, isn't it? Just because that's the message.